Are you wondering what a natural or bioidentical hormone is? If you are, then this video is for you. It's Dr. Durst with RMD Podcast, and I am here today with my co-host, Faraday.
Hey guys, Faraday Golembieski. I'm a family nurse practitioner at RevitalyzeMD.
So today we're going to talk about natural versus synthetic hormones, and the natural term even threw us off. What does that mean exactly? So, which HRT is better, or hormone replacement therapy? Is it natural or is it synthetic? So, we're going to go into natural first. When we're talking about natural, we mean that it's identical to what is produced in the body.
Yep,
And
or bioidentical. That is the key term that's thrown around a little bit more, but
correct.
natural has come up, so they're interchangeable.
And really, it threw us off because for us, natural almost means you're doing a supplement to naturally increase your own hormone production. But natural means identical to, so it really means bioidentical hormones, which are like a key in a lock. It fits exactly in the lock. And a synthetic is different. And so if you had a lock, the key would not fit. So the hormone, when it's synthetic, does not fit perfectly with the receptors in our body.
Yep, it is synthetically made to mimic our hormones.
Correct. It has to be different in a way from our hormones for it actually to be patented and taken to market. So there has to be something different about it. So basically, when we're talking about natural, that means bioidentical. And bioidentical means that it is identical, like we said, but also produced from natural substances such as yams,
Or soy.
soy. Yeah. So those are, but how is that produced? So are they just taking a yam and producing it? But
I
no.
had somebody ask me, can I just eat a bunch of yams?
I know.
I'm
I
like,
know.
not quite. I wish it was that simple.
So they're really taking it and making it in, a lab. So they're making it from natural substances, but then those are bulk substances that then are obtained from pharmacies, and then your formulation of a hormone product is produced. And so basically, when we're talking about that, we're talking about compounding pharmacies because it's more customized, can be changed. They're the ones that get the bulk substances, those compounding pharmacies, and then make it into a product that we can actually then prescribe to a patient. So
And then
there
customize per patient.
is the key. So the big issue is this. Are compounding pharmacies an issue? Like it does seem to be. And we're going to do another podcast on that. We actually have done a podcast on that, talking to our local compounding pharmacy, who is awesome. But basically, compounding pharmacies are FDA regulated. They're also state regulated. They're inspected. They need to prove their formulas. They have to actually prove that what's in the product is there. And so, really, what you want to do is just find something, a reputable compounding pharmacy. Not all pharmacies are the same.
That's
Not
it.
all, any kind of business, not every business is the same. So you want to find one that is accredited and has a very good reputation and are trustworthy. And
And you
so
can even look up pharmacies online and see if they have any derogatory marks against them from the state or any issues. The one that we use local is been around a long time. It's trusted. They have great sources. We have a good relationship with them. They don't have any derogatory marks against them, but they almost go through a more rigorous process than a regular pharmacy because they have all these extra checks as a compounding pharmacy.
Yeah, and I think that again, they are definitely, I feel, more highly regulated.
They are very much so regulated.
And when we go back to safety concerns, and I actually had looked at, again, major societies that are putting out guidelines in the safety concerns related to compounding pharmacy, such as don't use compounded farm or medications or hormones. Instead, you need to use just topical testosterone, for instance, for women, but not from compounding pharmacies. When you actually click to the link, it goes back to 2011, 2012 with like a case of an injectable that caused an issue. So we're talking about historically, is there ever an adverse? There is with manufacturers as
The
well.
synthetic and
With synthetic,
compounded.
anything conventional, so you're almost looking at a compounded product versus a conventional. And so there are issues with conventional products too, and there are reporting sites that they have to go to.
Yep.
The only issue is that if it ever happened, and before there was like one, or there was actually a series of cases, but back in 2011, 2012, related to spinal, I think, injections or a
It
spinal
might have
infection
been.
related to an injected compounding pharmacy. So we're talking about something that is still actually being magnified, but
Hmm.
really an accredited compounding pharmacy can make a great product that is uniform in quality and
From a natural
trusted.
source.
And you know how we can tell this? Because we do blood levels all the time based on compounded products. And so we customize for our patients and we can actually test blood levels and we see that go up versus baseline. So the
And
safety
sometimes
isn't a
when we
concern.
pull patients off synthetic products and put them on a natural product, we see levels improve.
True. So
So it goes both
really,
ways.
natural is bioidentical, compounded is what we're talking about versus a conventional or synthetic that has to be changed from a natural substance so that it can actually be taken to market and patented.
Yep. And
And
that different chemical structure, because it's not identical to us, so in a synthetic hormone, that difference in that structure is where we can see some of our negative side effects. So I think it's important to kind of point that out, because if it's not identical to us, then what's left over?
correct.
Where is that other piece going? As Dr. Durst said, it's a lock and a key. So if you're putting a lock and a key and it's a natural or bioidentical, it fits perfect. There's nothing left over. There's nothing extra. However, you've got that synthetic, you've got these other branches that are going off that then can potentially wreak havoc in the body or cause other side effects.
So yeah, you're talking about the side effects.
Hmm.
And then also, again, cost. And so a lot of times they'll say that cost might be higher with compounded. And, I don't know that that's the case. We really haven't seen that. But what is worth, and again, it depends on what pharmacies you're using, it depends on what traditional pharmacies you're using. But the big issue is customization, and the cost related to that is a whole different topic. And
Yeah.
so if you can customize and you feel better and you're optimized, then, cost, it's comparison. Like it matters what's important to you.
So then we kind of get in, we've already started, right? The pros and cons of each.
Yes.
So
Yeah.
now we understand what a natural bioidentical is, we understand what a synthetic is, and then what those benefits are, which we've already kind of hinted on, right? So
Yes.
with a
Yeah.
natural compounded product, we have less negative side effects. There is some speak out there that, like Dr. Durst said, it's more expensive versus a synthetic, yet you're getting a better product.
Yes. Yeah.
Sometimes you pay for what you get. I I don't see a crazy increase in price with that, but when you're compounding, that may play a role with insurance, what's covered, what's not covered. But we don't see any crazy increase difference
I
between the
think
two.
that's the big issue is we do not see that in practice, and it's actually incorporated into programs, but also the insurance, if it's covered, yes, so it might be considered, but honestly, some insurance companies don't cover, some insurance companies, it's a real hassle.
Mhm.
Sometimes if you factor in the cost of the phone calls you make and the time that even a physician's office would have to make sometimes to get approvals. But as we know, it can almost be a full time job getting things covered by insurance. So, again, just factor that in, and it matters what's important to you, but just know that the side effects are less and
We can
that and we
customize.
can customize. And I think the other, pro for synthetic is people will talk about the safety because of research,
Yeah.
but that research is done by big pharma. So keep that in mind. So a lot of times that if a big pharmaceutical company is driving research, are the results, I mean, really, we should be doing research independent of any regulatory bodies or any pharmaceutical companies to get real data.
And pull the
So,
bias out of it.
yeah, so when there's a bias there, just keep that in mind, although I think everyone really does get that. And you cannot take it and patent. You're not going to spend a lot of money taking it to market and to patent it or take it to market and research it. So a lot of money goes into that research. No one's going to do that unless if they can get a patent, which protects their investment of research for about 7 years. And so without that ability, and you can't do that with bioidentical products, it has to be changed in some way, that it's not going to happen. So if you're looking for extensive research on compounded natural products that are identical, you're not going to get it.
It's going to be
Because
harder to find. They're going to be smaller studies. They're just not going to be, like Dr. just said, extensive. If you're looking for that, that's where a synthetic hormone has. They have a lot of research because
Yeah.
it's big pharma driven.
I think that what you'll find is you'll find research studies that are more independent, but survey based, blood level, some clinical factors. So, but really the question is it effective and is it safe? And compounded or natural products are both safe and effective. And that's the key. And so, were there other standardization was one of the question or one of the potential pros for the synthetic?
Is that it's very standard, but what we see is standard doesn't work for our patients. That's why they're seeing us, is because that traditional route didn't provide resources or answers. And they may have already tried a more standardized protocol
Yeah.
and failed. So they're looking for something more customized.
And when we're talking about standardization of a product, then we're talking about the fact that it is standard what a compounding. So if you have an accredited pharmacy, they are more than regulated and they have to prove with independent testing that what's in the product is actually in the product and uniformity is there. So on the other flip side, like Faraday says, standardizations also means more of a one size fits all, which is what doesn't work for a lot of patients, which is why they're in front of us. So for us, I will
Which would
just
be a
say,
con
yeah,
of the synthetic. It's a one size fits all,
yeah.
where we can customize the natural products.
So I would say that again, across the board, going with natural or bioidentical versus conventional or synthetic, it really is about treating the patient and customizing it for the patient. So, if that includes, again, an injectable testosterone product that is conventional, we'll use it. If it includes a compounded pharmacy that can better be customized to improve the symptoms our patients have, then we do it. And so I think it's using whatever's best for the patient.
That's it. It's
And
not we only do one or we only do the other. There are a lot of mixed products used based on patient need.
correct. I think that if ever we're looking for insurance companies to approve everything, well, you have to think that right now your physician is being directed by an insurance company, how long they can see you, how often they can see you, and what products they can use. And do we really want insurance companies dictating our care? No. We want the physicians to dictate our care. And so we have moved away from that. So I would just say that if you're waiting for insurance coverage and we're waiting for, like, for instance, insurance based coverage for women in testosterone, you're going to be waiting a long time because it's not going to ever happen quickly that a doctor is again dictating that care strictly. Instead, that is indirectly or directly, because they'll report it, that the insurance companies are dictating how often we can see you and how long we can see you and what's covered and what
treatment path
well, yeah,
we've got to take and fail before we can move on to the next steps.
correct. So that's our stand on it. We see patients on a daily basis with all the symptoms. We do lots of videos. If you want to know anything specific, want to have a discussion, you want us to cover anything specific, let us know. But we will just say that we treat and have now for a long time patients with both, and definitely with compounded or natural bioidentical hormones with great responses, very happy patients, and likewise, very little in the way of adverse effects. And that's really, again, patient dependent. It depends on the patient, and you're customizing and you're addressing or preventing side effects. And so, but we're
If
not,
there's a commercial product that's safe and effective, that's the best option for our patient, we will recommend it. However, most of what we do is more natural bioidentical because the fewer safety, the fewer side effects, the bigger safety profile on
yeah.
them.
So we follow frequently and with blood levels. So we can tell you that compounded products are not an issue because we are seeing blood levels that go up and symptoms that are improved. So the product is of high quality and safe, and that's because we're using, again, accredited pharmacies or a combination of products. So if you have any questions, let us know. If you've had any bioidentical or synthetic hormones that you want to let us know your experience with, please do drop it in the comments.
If you've used one and then switched to another and had different varying results on the same medication, just a different form of it, a natural form versus a synthetic form, I'd love to hear that.
And if we haven't covered every issue, question, concern you have with compounding pharmacies, let us know specifically what you want us to address, because we will. So just remember, we're willing to deep dive into anything wellness or sexual wellness. So just let us know.